Good day, guys, and welcome back to my channel, Health Matters with Quincy. So, before we go into what we have for today, to all my amazing subscribers, thank you so much for all the support. Thank you so much. And then, if you're coming across my video for the very first time, you're welcome. Please don't forget to subscribe, like, share, and comment, and stay tuned for many more on this channel. So today, guys, we'll be talking about PCOS, that is Polycystic Ovary Syndrome. Yes, it's looking broad, but my work here is to break it down into different pieces for you guys to understand. So from the word ovary there, you realize that this refers to persons who have ovaries, or it refers to women, basically females. So Polycystic Ovary Syndrome is a common hormonal disorder that affects women of reproductive age. That is, a girl child that starts seeing her monthly flow to the ages of 45 to 50. Within this range, we refer to them as reproductive age. So, moving over to the signs and symptoms of Polycystic Ovary Syndrome. One, we have irregular menstrual flow. For instance, as a lady, you see your monthly flow after every 28 days, or after every 16 days, or after every 20 days, depending. Maybe after a while, it changes from that 28 days to 20 days. From 20 days, it goes to 28 or goes to 24 days. It's not normal. It's not going through a normal routine, so it's irregular. We refer to it as irregular monthly or menstrual flow. We also have infertility. That is difficulty conceiving children. Then we have weight gain. Persons with Polycystic Ovary Syndrome are known to be obese. They have excess weight gain. And then we also have excess androgen levels in the body system. Then we have polycystic ovaries. That is polycystic ovaries. When you go for an ultrasound, then you see in the ultrasound that the ovaries are enlarged and there are multiple cysts around it. Then we also have hair loss. Persons with Polycystic Ovary Syndrome are known that their hair tends to fall off. They don't always have much hair on their body skin, even on their head. So we also have mood changes such as anxiety and depression. Women suffering from Polycystic Ovary Syndrome tend to suffer from anxiety and depression due to the illness. So we move over to the causes of Polycystic Ovary Syndrome. There's no known cause for this, but there are some factors that can contribute or that can lead to it. First, we have hormonal imbalance. That is, hormonal imbalance also has to do with irregular menstrual flow and the rest. And then we also have genetics. Yes, when an auntie of yours or mom or grandma or someone in the family or a sister has it, likely that person is going to have it. And then we also have excess body weight. Excess body weight, when a person is so overweight, then it can lead to Polycystic Ovary Syndrome. Then we also have, so I don't have to forget, insulin resistance. Yes, this is when the body system is not responding very well to the insulin in the body system, thereby leading to higher levels of insulin in the body, and this is not good, and it can lead to Polycystic Ovary Syndrome. Then moving over to the risk factors of Polycystic Ovary Syndrome, we have family history. If someone in the family has it, for instance a mom, grandma, auntie, sister, anyone has it, then that person is likely to have it. Then whoever is in this family is likely to have it. Then we also have obesity. Persons who are obese are at risk of having this Polycystic Ovary Syndrome. Then we have sedentary lifestyle. This is when maybe the person smokes or the person drinks so much alcohol. You are at risk of it. When you don't exercise, when you don't take the right meals, when you always take junks, snacks, fatty meals, all these can put the person at risk for Polycystic Ovary Syndrome. Then we also have insulin resistance. When the body system is not responding very well to the insulin in the body, you are at risk for having Polycystic Ovary Syndrome. Then moving over, we have types of Polycystic Ovary Syndrome, PCOS. Yes, PCOS, polycystic ovary syndrome. We have types, but for this video I'll be saying just 2 types. And first we have insulin resistant polycystic ovary syndrome. This is a polycystic ovary syndrome in which the body system doesn't respond well to the insulin in the body. When it's not responding well to the insulin in the body, it leads to increased levels of insulin, and then this thereby causes excess levels of androgen in the body, which also makes the symptoms of polycystic ovary syndrome more severe. Yes, it makes it more severe. Then we also have the second type. We have post-pill polycystic ovary syndrome. This occurs after discontinuing birth control pills. Yes, after discontinuing hormonal birth control pills. But it's kind of a temporal hormonal imbalance. It comes with irregular menstrual flow, acne, and the rest. But it resolves on its own after a while. Yes, this type is not too severe, but it's a type. And then we also have management of polycystic ovary syndrome. Yes, the management of polycystic ovary syndrome. First, we have lifestyle changes. We have exercising. You have to exercise so as not to be too obese, because being obese puts you at risk for polycystic ovary syndrome. And then we have weight management. Watch your weight. Know when you're becoming too big or too small. Just always watch your weight. Once in a while, you go to the hospital, you go to the clinic or the pharmacy or the health center and check your body weight to know your body status and know what is wrong with you at a given time. Then we also have diet. Watch your meal. Don't always consume fatty meals. Don't always eat junks, snacks. Eat the right meal. You can go to the hospital and ask the nutritionist there or the dietitian there to recommend this proper meal for you to eat. Yes, and before I forget, once you start noticing any symptoms or anything, please go to the hospital, see your doctor, talk to your doctor. You can either go to the health clinic, the health center, the hospital, any medical place close to you. You go there that is satisfied, go there and complain to them, tell them, and then they recommend what to do for you. So continue with my management. You also have medications. Yes, medications. When you go to the hospital, the doctor will recommend a particular drug or pill or what to do. Once he tells you, you follow it, and then by the grace of God, then you can get yourself. Under the medications, we have metformin, and then we also have birth control pills. Yes, when you meet the doctor can recommend birth control pills depending if it is post-pill polycystic ovary syndrome. Then he can recommend drugs for you. And then we also have fertility treatment when, like I said, in the sign and symptom, we have infertility as a sign and symptom. So when you are having difficulty conceiving, it's not the end of the world. You go to the hospital and then they recommend fertility treatment for you, such as IVFs and so on and so on. If any of this is not working out, then you can also adopt kids for yourself, for your family, and then life goes on. Then we also have surgery, which we call ovary drilling. This is more like putting holes through the ovaries so that there won't be high levels of androgen in the ovaries. So we also have supplements, but this supplement has to be recommended to you by a doctor, by a physician, by someone in that area. Yes, especially a gynecologist, someone who sees about this. And then we also have vitamins. He can recommend vitamins and the rest for you. So please guys, if you notice any of these symptoms, please do go to the hospital, meet your doctor, and before you conclude that something is wrong with you, make sure you have run a series of tests that has concluded and has stated that you have such. Please do not start treating yourself without knowing what is wrong with you. So thank you so much. But wait, I forgot to say something. One particular complication of this polycystic ovary syndrome, just one I want to say here, is diabetes. Persons who have polycystic ovary syndrome, it can can get complicated into diabetes. So please, when you notice any of the sign or symptom, please treat yourself, go to the hospital, seek medication, seek treatment, seek counsel, so that you get yourself, so it doesn't get to something broader or something more difficult. God will help us and see us through. Thank you so much for watching this video, and I hope it's kind of helped and added to your knowledge. Please don't forget to subscribe, like, share, comment, and stay tuned for many more on this channel. Bye guys.